From the JAMA Network, this is JAMA Ophthalmology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Ophthalmology.
Welcome to this author interview from the JAMA Network. I'm Neil Bressler, Editor-in-Chief of JAMA Ophthalmology. Today, we're going to look at potentially a very important case report on severe Spaceflight-Associated Neuro-Ocular syndrome, which goes by the acronym SANS, in an astronaut who may have had predisposing factors for SANS. And joining us are two of the authors. First, Dr. Scott Smith. Dr. Smith is one of the corresponding authors of the investigation and is with the Human Health and Performance Directorate at the NASA Johnson Space Center in Houston, Texas. Dr. Scott Smith, thank you for joining us.
Thanks. It's a pleasure to be here.
Also joining us is one of the advisory committee members to the editorial board of JAMA Ophthalmology, who also is a neuro-ophthalmologist with a research interest in SANS, Dr. Andrew Lee. Dr. Lee is the chair of the Department of Ophthalmology at the Houston Methodist Hospital. And Dr. Lee, thank you also for joining us.
Thanks for having me.
Scott, maybe I could just start with you for our audience because they may or may not be familiar with this term SANS, this Spaceflight-Associated Neuro-Ocular Syndrome. Could you tell us briefly what is SANS?
I'll caveat up front that I'm a nutritionist, so I'm a bit out of my realm here. But in my perspective, SANS is a set of signs and symptoms that some astronauts develop during spaceflight. There's a number of hallmarks, including things like optic disc edema, choroidal folds, cotton wool spots, you name it. And this came about around 15 years ago and has been the subject of intense study by NASA and individuals literally around the globe. And what I always like to highlight are two key elements of SANS. One is that as of right now, we don't know what causes it. And two, not everybody gets it. And trying to understand the nuance in there is really the crux of some of our work.
So, Andy, let me turn to you. You helped us describing some of these with a podcast that we had several years ago, where many of our listeners were just hearing about SANS for the first time. And we heard from some people at NASA that told us, if you can't see well on a long-duration spaceflight, you may not be able to go to Mars and come back until that's solved. Maybe you could tell me, why is it so important to know about SANS and these signs that Scott was describing?
So the things that Scott described, optic disc edema, the choroidal folds, and what we see as a hyperopic refractive shift from axial shortening are presumed to be microgravity related in some part from fluid, either in the eye, in the choroid, or behind the eye, compressing the eye and causing the ophthalmoscopic features. And so, of course, those can impair your vision. And we do have astronauts with decreased vision from the refractive error shift that have had to wear space anticipation glasses, which is basically reading glasses in space for the refractive error shift. But the good part about it is it has not produced any permanent vision loss. But of course, astronaut vision is super important, not only for their safety, but for mission quality and achieving success in the mission. So it's really important not to have blind people going to Mars. But so far, so good. We have not seen any permanent vision loss from any SANS case, and the treatment seems to be come home. So once you get back to the gravitational field of the planet, it seems to just go away after a while. So good news, it doesn't blind anybody, and also good news, coming home seems to reverse it.
Now, Scott, before we get into some ways of treating this that also are going to touch on some of your expertise in nutrition, could you highlight for our listeners a little bit of what was so unusual about this case to warrant highlighting or pointing out this one specific case of SANS? What were some of the features that were so unusual in this particular astronaut?
Indeed, this case had several characteristics that were unique that many of us on the team that brought this forward, I think many of us had our own favorite spots, if you will. One of the first things is that this was in a woman, and to date, very few, if any, of the cases reported have been women. And for a long time, it was thought that this might be a male-only syndrome. And there was always the question of, well, perhaps we just haven't flown enough women. But this one easily puts that to bed. The work that my team has been doing for about 13 years now, has been following up on some biochemical differences that we saw in affected individuals. That is, differences in B vitamin related 1-carbon metabolism. And we found a couple of SNPs that seemed to be predisposing. And in this individual, they had 4 out of 4 of the key risk alleles that we've been looking at. So that was one of the things that really jumped up to us. And then this was, again, the most serious case that we've reported to date. And not only that, it was also a case where there was an effort made to use a countermeasure. Again, one that we've been touting for a while now, that B vitamins might be able to help mitigate this problem. And B vitamins were flown and seemed to help not completely resolve, but the optic disc edema got a whole lot better very quickly.
So when you say they were flown, were they not on the space station itself and they were delivered with a subsequent delivery?
That's correct. And literally, when we look back through our notes, when the flight surgeons who were treating this individual had this problem, they called us and said, well, you've talked about flying vitamins, or giving people vitamins. What would you give? And again, when we look back at the records, found that lo and behold, they packed some up in the next cargo vehicle and sent them up in the middle of the mission, which tells you how significant an issue this was at the time.
So, Andy, before we get to the course of this particular case, as a neuro-ophthalmologist, I think one of the most common diagnoses you're asked to evaluate is optic disc edema. And I know you have more than just SANS in your differential diagnosis for that. So is there anything else this case could be coincidental to going up in space and having this microgravity perhaps predisposed to SANS, or predisposed to a very severe case because of some of these predisposing factors that Scott was describing to us?
Yeah, so what Scott described, we see that on Earth, of course. Terrestrial disorders often have predisposing genetic risk factors. And as Scott alluded to, not everybody gets it. And the people that have had it before are more likely to get it again. And people who didn't have it when they fly again don't seem to get it again. And so this whole concept of a predisposing risk factor and a two-hit hypothesis, if you will, that you have some genetic predisposition, and then you have this second event, which is presumably microgravity related in some way. And then you have a de-challenge, re-challenge, come back to Earth, but now you have a pharmacologic treatment that seemed to have an impact on it. So we don't really have a biomarker currently for SANS. There's no get the SANS test, but potentially the things that Scott is speaking about as a nutritionist could be a biomarker for risk, and could help us determine a countermeasure that we could give prophylactically rather than waiting until something happens. So clearly there are terrestrial analogs for what we observed in this particular individual in terms of a unique person at risk, but also a potential experiment, if you will, for testing a countermeasure.
But other than SANS, if you saw these features of this particular case, of the features that were shown in the article, is there anything else in your differential diagnosis? If the person was just walking in, and of course you would know that that person had not been up in long duration space.
Yeah, in fact, initially it was thought that increased intracranial pressure was the cause. The syndrome didn't used to be called SANS. It was visual impairment and increased intracranial pressure. VIP was what we called it. But it became clear over time, as Scott has alluded to, that it was more than just pressure. And so now you have nutritionists on board, you have vascular people, you have ophthalmologists, neuro-ophthalmologists. And so on Earth, of course, we'd be worried about increased intracranial pressure. And the closest terrestrial analog that we had was idiopathic intracranial hypertension, because nobody had a tumor in space, obviously. And so the scans, when they return, also are at most analogous to increased intracranial pressure here on Earth. But there are other things. Hypotony was on the list initially, but we have a tonometer on the station, and so it was not hypotony, which could, of course, cause choroidal folds and disc edema. And then you've got vascular congestion. So it's like a three-part story: intracranial pressure, intravascular pressure, and then perhaps intraocular fluid, including the choroid, and that's like an intraocular pressure from a volume increase in the choroid. So we still don't know what the cause is, but it's probably an interplay between these different compartments.
Fascinating. So, Scott, what was the precise treatment or nutritional supplements that were considered in this particular case? And then what was the time course after initiating those? Was it getting better before that, and this was just a continuation? Was there no improvement seen until after those were initiated? And if so, how long did it all take?
Well, what we've advocated is that, again, it's an impairment in the one carbon biochemical pathway, which has multiple vitamins intertwined. So we've advocated, and what they flew was folate, vitamin B6, vitamin B12, and riboflavin. And we don't have perfect insight into the timing of those things. We know when the supplements were launched, we know when they were unpacked, and this was done as a treatment. It was not done experimentally. So we didn't get an OCT image right before the supplementation started or anything like that. But when we look at the data, it appears that the disc edema started to subside very quickly after the supplements started being taken.
And Andy, as a neuro-ophthalmologist, not speaking on behalf of NASA or the official treatment of SANS at this time, but as a neuro-ophthalmologist, what's your opinion as to what the next steps might be? Should these vitamins be on board? Are there other ways of testing this? Should this be looked at with other studies on Earth? What are the next steps that come to mind to you, understanding this is not any NASA official recommendations?
Yeah, so I think that it's an intriguing hypothesis. We certainly have terrestrial analogs. The closest example for us, and also in medical retina probably, is the one carbon story in terms of homocysteine. So homocysteine on Earth here is a graded risk factor for thrombosis. It's been hypothesized that it can lead to sludging and increased intracranial pressure in IIH. And certainly there are vitamin deficiencies that cause optic neuropathies. So I think that there is a biologically plausible mechanism for the one carbon pathway to be involved as a predisposing risk factor for many of the findings that we see in SANS. And one of the interesting things that we see in SANS is this cotton wool spot, which, of course, the pressure things don't explain well. And I've always thought could be radiation, but perhaps it is a small area of neurofibrillary infarction that would support a vascular, local hyperviscosity or homocysteine directly related problem that we could reverse on Earth with vitamins. So we give on Earth the folate, and even though sometimes I think we're treating ourselves more than the patient, we know that that is a plausible link between a terrestrial vitamin-related thing and something that looks similar to what we see on SANS. So I think it's an intriguing hypothesis, but I'm glad you said I don't speak for NASA at this point, because I certainly don't. Anything that we would do for vitamins in this regard or screening people is completely speculation. And I don't know, but it's opened up a whole new area what this case has for me. And certainly there are terrestrial analogs that we could test it on without having to do it on SANS people first.
And those neurofibrillary infarcts, do they occur close to the edema or they occur anywhere in the retina? Because if they're close to the edema, we've always wondered if maybe structurally there's some slight swelling of the tissue that in a tiny little capillary may allow a neurofibrillary infarct rather than having them occur anywhere in the retina.
Yeah, they're quite remote from the disc head. So as opposed to papilledema-related cotton wool spots where we can say, well, it's just mechanical, as you mentioned, and we see those all the time in the earth-bound disc edema, but these are relatively far away, and many of the cotton wool spots occurred after return to Earth. So it's a little bit of a delay there. And so one of the things I thought, and again, I don't speak for NASA in this regard either, but radiation exposure, some of our astronauts report seeing photopsia, like a little flash of light, and maybe they were hit by a high energy galactic cosmic ray or a high energy particle. We really don't know because it's very focal. So it doesn't look anything like radiation retinopathy here on Earth. It's like a focal thing. And so that would require a high energy particle to hit at a very specific location and then have a delayed reaction later. But we really don't know. This is completely speculation now because we really don't know.
Well, I want to thank you both for sharing your insights today and for both of you and your co-authors for putting this case report together. It's not often that we might just have a case report because of all the limitations that we all know that are involved in a single individual. On the other hand, these are very rare, and I think we have to do what we can to try to help understand this, not only for the astronauts in space, but it may help us in understanding what's going on Earth as well. So we've been listening to two of the co-authors for a potentially very important case report, which was on a very severe case of Spaceflight-Associated Neuro-Ocular Syndrome, which goes by the acronym SANS. We've been speaking with Dr. Scott Smith, who's with the Human Health and Performance Directorate at the NASA Johnson Space Center in Houston, Texas, and Dr. Andrew Lee, who's a neuro-ophthalmologist and chair of the Department of Ophthalmology at the Houston Methodist Hospital, also with a research interest in SANS. I want to thank both of you so much for sharing this and giving us a little insight on this potentially very important case. Dr. Smith, thank you so much.
Thank you. We appreciate the opportunity.
Dr. Andrew Lee, thank you once again.
Thanks again for having us.
This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.